this is Dr. Wells of Wells Medicine, and I wanted to talk today about labels. So I love a good label. I think labels can be very, very helpful. I have had patients who received diagnoses while they were in treatment with me that they said changed their lives. So labels can be amazingly helpful. When you get a diagnosis that all of a sudden allows the pieces to fit together and gives you great insight onto struggles you may have had in the past, or reasons medicines did or didn't work, or relationships that you may or may not have struggled with, I think they can be so helpful. But I think that labels also box us in and sometimes make it harder for patients to get well, and sometimes make it harder for patients to categorize how they're feeling, whether it's normal emotions that a neurotypical, I hate normal, but neurotypical person would feel in this circumstance versus emotions that someone with anxiety or depression would feel in this circumstance. So for example, one of the things that I see a lot is that once patients have a label or have a diagnosis, especially when they've had it for many years, or especially when they've had kind of add-on diagnoses like, oh, well, you have depression, but you also have treatment-resistant depression, and you have some personality disorders, and you have generalized anxiety and social phobia and panic disorder. Once patients have a long list of diagnoses, sometimes it's harder for them to not feel like they're broken. And one of the things that I try over and over to talk to about patients is to remind them that we may have lots of diagnoses, but that doesn't mean that we are broken. And so what I mean by that is a person with diabetes may have to be on medication and may have to watch what they eat and may have a diagnosis that stays with them for life that they still need to continue to be careful with, but that does not mean that they are broken. They may have to change some of the things that they do, but I'd rather have them say I am a person living with the illness of diabetes than say I am diabetic and I am broken and, I'm kind of forced to do all of these things because of my brokenness. I think that's where we get into real danger with labels. So one of the things that I see a lot of is a patient who's been doing really well for a long time will come in and say, well, the ketamine is not working anymore. The TMS isn't working anymore. I need a new stellate ganglion block. My anxiety is very high right now. And when you talk to them for a little while, what you'll find out is their dog died, or they just got robbed, or they're about to change jobs, or something is there that a neurotypical person might also struggle with. But having those very negative feelings, the grief, the sadness, the anxiety around a job change, even though those are very neurotypical feelings, having those feelings is a struggle for patients who've dealt with anxiety or depression or OCD or PTSD in the past, because it brings up this feeling of, this is just my depression coming back. This is just my anxiety coming back. Other people don't struggle with this because they don't have depression or they don't have anxiety. As opposed to seeing that this can be very neurotypical emotions with the circumstances that they find themselves in. Similar to the idea that like a person with diabetes might say, well, but everyone else can eat 5 donuts, but I'm broken, I have diabetes, instead of saying, well, a neurotypical pancreas still probably can't handle 5 donuts. that would be a lot for that pancreas. I bet that person would actually feel quite awful if they ate 5 donuts. There's a tendency to say, well, but I bet, a neurotypical pancreas could handle that. Similar to someone saying, well, I bet a neurotypical person wouldn't be struggling with this. But sometimes there are just some really hard things in life that are going to be a struggle, whether you have depression, whether you have anxiety, whether you have OCD. And sometimes when we come across those milestones, it's really important to recognize there's our label and there's a neurotypical struggle, and kind of understanding that this may not be the best time to increase your medicine. This may not be the best time to kind of dump everything into a depression bucket or an anxiety bucket, but this may be a really good time to fall back on, can I reach out to more people who are going through this same issue or this same struggle? Can I, maybe have another ketamine or another TMS treatment, but then also really re-emphasize what a neurotypical person would do as coping strategies during these times. So going for more walks, making sure that you're optimizing sleep and really taking care of yourself, understanding that this can be a very difficult, vulnerable time. Not just that this kind of lumps into depression or lumps into anxiety. So I just wanted to remind people that labels can be beautiful and they can help make things a lot more clear and make a lot more sense. But they can also really tie us down and cause us to think that everything gets lumped into those labels, when sometimes it's just the really hard struggles that even patients without those labels are going to go through. And that is a really good time to kind of reaffirm those neurotypical coping strategies of exercise and sleeping and self-care.